Okay, so every year in the summertime, my family makes a trip down to Monterrey, Mexico to visit my mother's family. A few years ago, on the way down, we stopped at this store to get a drink made out of fruits, right? And my aunt got one, and everything was perfectly fine for a week. But one day she just woke up with this rose spot rash. At first, we thought it was an allergic reaction, but then she started showing signs of an infection. And my mother made her check into the hospital, and she was later diagnosed with typhoid fever. Hi, my name is Clarissa Fuentes, and I will be presenting typhoid fever. So today I will be talking about the history, transmission, symptoms, experiment, diagnosis, treatment, and prevention of typhoid fever. Typhoid fever is caused by the bacteria Salmonella typhi. It is a highly adaptive, human-specific pathogen that is only found in humans in their bloodstream and intestinal tract. It was the main cause of death in the 1900s in Europe and the United States. And today it causes 16 to 21 million cases, and 200,000 of those cases are reported right here in the U.S. The first person to assume that the cause of the typhoid fever was a microorganism was Carl Leibnister, and he attempted to prove that the disease was transferred through contaminated water. William Budd, though, however, in 1873 discovered that it was transmitted through a specific toxin found in the excrement of patients. And in 1879, Carl Joseph Edberg discovered the bacillus in the abdominal lymph nodes and spleen. The first carrier of typhoid fever in the Americas was a woman named Mary Mallon in the 1900s, and she was forced into quarantine 2 times for a total of 26 years, and in 1909 unsuccessfully tried to sue the health department claiming she did not have typhoid fever, but lost because 121 out of 163 stool samples tested positive for the disease. In 1910, she hired a new health commissioner to free her, and on the circumstances that she wouldn't go back to working as a cook. But once freed, she went right back to being a cook, and in a short 3 months infected 25 people, the majority being doctors and nurses, and killed 2 doctors. She attempted to change her name Mary Mallon tried to change her name because she was therefore stigmatized as Typhoid Mary, and became the butt of jokes, cartoons, and was even put in medical dictionaries. And now the name is given to a potential suspected or an actual carrier of typhoid during an outbreak. In 1911, the search for immunization against typhoid fever began, and it wasn't until 1948 when Mary Mallon died that the antibiotic against typhoid fever was discovered. And then in 1950, a C-resistant typhoid fever became a problem, and it wasn't until the end of 1980s to 1990s that Salmonella typhi developed resistance to all drugs that were being used as first-line treatment. Salmonella typhi produces and releases a potent endotoxin that is once consumed orally, and it is transmitted through consuming food or beverages that have been handled by a person who is shedding the bacteria through their stool. Sewage is also possible to contract the disease by using sewage contaminated with Salmonella typhi that gets into the water you use as food, and even to water that you use to wash your body with. An asymptomatic period lasts for 7 to 14 days, and an incubation period of this is 6 to 30 days. And the first symptom to appear is the rose spot rash. A low-grade fever is the second symptom, and it rises progressively to 103 degrees Fahrenheit to 104. Fever-induced convulsions are common in children under the age of 5, and women who are pregnant with typhoid fever usually experience miscarriage or a damage to the fetus. Headaches can range from just a minor headache that you can treat with ibuprofen all the way to a pounding migraine that can last for more than a few days. And abdominal pain does occur, and patients over the age of 18 they experience constipation, but in patients under the age of 18, they are more likely to experience diarrhea. It is uncommon for a patient to be hospitalized with this disease and have normal bowel movement and no abdominal pain. 3 weeks into the disease, if you are not treated, you become extremely agitated, delirious, or obtunded, and a complete stupor or coma is very infrequent, but it can happen. Relapse occurs in 5 to 10% of patients, and 2 to 3 weeks after the resolution of the fever. And a secondary, and the most common places for a secondary infection is the liver, spleen, and bone marrow. Complications occur in 10 to 15% of the patients, and this happens when the bacteria reproduces way too quick, more than it actually should, in the liver, spleen, or lymph nodes, and when this could lead to a hemorrhage, which could be fatal. In my experiment, scientists wanted to see if it was possible to be immune to typhoid fever, so they used six chimpanzees, two who had previously not been infected and 4 who had been infected and recovered. To stimulate them being infected, they inoculated a banana with a strain of typhoid fever called TY2, and they checked up on the chimps for the next 3 weeks, looking at their symptoms. The 4 previously infected and recovered chimpanzees showed signs of infection for the first 3 days maximum, and then showed negative thereafter. And each infected chimpanzee produced a relatively small numbers of typhoid bacilli in their stool, and they stopped shedding it a week and a half later. In conclusion, the relative size of the infecting doses that led to the either partial or complete immunity of the re-challenged animal, and they explained that they used chimpanzees because how the typhoid fever affects the chimpanzees similar to the human, and so the recovery from this infection could lead to protection against typhoid fever with the administration of vaccines. To diagnose typhoid fever, doctors depend on your medical and travel history, and it is confirmed by identifying the Salmonella typhi strand and the culture of your blood or other bodily fluid or tissue. For the culture, they take a small sample of your blood, urine, stool, or bone marrow and incubate it for 48 to 72 hours, and then check for the strand when they're done. Before this was discovered in the 1900s, they used a test called the Widal test, which had a low sensitivity and caused many misdiagnoses. And they still use this test in third world countries since it is it was in a low expense cost, so many patients are treated incorrectly. There is one antibiotic that can be used called ampicillin, and it is only used once, and that is with the inclusion of the removal of your gallbladder. 2 vaccines are available for travelers, and one is injected in a single dose a week before you leave to go on your trip, and the other one is given orally in 4 capsules. One capsule is taken before you leave, and the other one is taken the other 3 are taken during your trip. Neither vaccine is 100% effective, and it is asked to get immunized, repeat the immunizations every 3 to 4 years. To prevent typhoid fever, there are 3 public health goals that you can take. One being make sure you're drinking safe drinking water. Never drink water that is cloudy, and always treat your water with chlorine, since that kills the typhoid strand. Make sure you have improved sanitation. Always wash your hands and have adequate medical care. And for travelers, there's one quote that they use to make sure that you don't contract the disease is to either boil it, cook it, peel it, or forget it. If you are recovering from typhoid fever, there are also 4 measures that you can take to help keep others safe. One is to wash your hands often using hot water, not warm or cold, just hot. Clean household items daily. Anything that has been touched by an infected patient should be cleaned with just regular cleaners and disposable wipes. Avoid handling food. This is until the doctor clears you. This is because you can shed the Salmonella typhi in your stool for up to a full year, and always keep personal items separate. In conclusion, salmonella typhi is caused by the bacteria. Typhoid fever is caused by the bacteria Salmonella typhi, and the first carrier in the United States was Mary Mallon. The most common symptom is a rose spot rash, and it is treated with antibiotics, but there is still no full cure. And the aunt that I had previously mentioned in my story was put into quarantine for 3 weeks. We weren't allowed to see her, and she wasn't allowed to come back into the United States until a month after she had been diagnosed, she had been cleared from the doctor. And these are my citations, and thank you.
Questions for Clarissa?
Yes.
Why do they have to check a person's travel history?
Because typhoid fever is more common in third world countries. So if you've traveled to somewhere in Africa or even Asia, they see if that's a common place for typhoid fever, and that may lead to you having the disease. Chris?
Okay, so is bacteria Salmonella typhi the only bacteria that causes typhoid fever?
No, there's another bacteria. I can't remember the name right now, but this is the most common one that causes typhoid fever. Ahmad?
First off, I want to say that was a great presentation. And second, do you know if there's any cure being made right now?
I believe there's a study being conducted right now, but the website that I was on was saying that they didn't have the expenses needed to finish it, but I believe they're very close to finding one.
Jazz hands for Clarissa.